are hospitalized with other conditions. I also want to call out our incredible caregivers and team members for all they are doing to care for our communities. Care for people who have COVID-19 and people who have other health concerns. We care for all, regardless of vaccination status, and I am especially grateful for our team members for what they've been doing throughout this pandemic. I also want to encourage people to get the vaccine. It is the best way to avoid serious illness and hospitalization. And so please take this surge seriously and do your part to stay healthy and well by practicing prevention and getting the vaccine. Now I'd like Dr. Daryl Amucci, the president for Spectrum Health West Michigan, to provide more information about COVID-19 numbers at Spectrum Health. Daryl?
Thanks so much, Tina. And hello, everyone. Thanks so much for coming. I'm going to actually start. I have 3 slides I'd like to share, and I'll speak over the slides. So if you could please put up the first. Almost. I'll start with, and I'll kick off the first slide, which essentially is our public dashboard for COVID-19. Many of you might be familiar with this. We've been having this updated on our website essentially every day for now up to 20 months. And if I'll call your attention to the upper left corner, or the number of COVID-19 positive inpatients we have across all of our hospitals, and that number is 367. Just to put that in perspective, when things got a lot better over the summer in Michigan, we were down to double digits, and actually, quite honestly, down to about 40 to 50. A week ago, we were 25% less, and on November 1st, we were 40% less. So we've seen a huge rise over many months, and then a dramatic shift up over the last couple of weeks. Another number I want to call your attention to is our percent positivity. You can see yesterday we were at 22.6% positivity on over 1,000 tests. Over the weekend, we had 25% positivity, and our rolling average 7-day positivity, which is 22.6% within our laboratory, is the highest we've ever seen it since the pandemic began. And then finally, you can see down below, we track very closely the number of team members who test positive. And just like we're seeing in the community, we're seeing a lot of team members test positive. Thankfully, almost all of our team members, and we'll describe that later, are vaccinated. And for those that test positive or vaccinated, all are doing very well, and we track that very closely. If you could move on to the next slide. This is a graph that I'd like to explain because I think it really tells a lot about what we're seeing. So if you look at the red curve, that was the first real wave of COVID we had. That was in the fall of 2020, and it really peaked right around Thanksgiving last year. And you can see a very rapid jump up, kind of came down, a little spike there, and then it went down pretty quickly. The green curve is the surge we had in the spring of this year, and that was less in terms of its height, and you can see a rapid up and a rapid down. And then blue is what we've really seen since the summer, this slow and steady march up, and then about 10 days ago, you can see a rapid inflection up where now the slope of that curve is much higher. And the challenge here, and Tina really mentioned it, is we are at about 85% capacity across our hospitals with non-COVID care. And that's pretty typical for this time of the year, with RSV season in children, with people with heart attacks, strokes, cancer care, and otherwise. And hospitals are made to be at around 80–85% capacity. The challenge is COVID is so much more now, and the volume is so much more that it throws hospitals across our state well over what is a manageable capacity. And that makes it really challenging, not only to care for COVID patients, but obviously to give the best care possible for people without COVID. And if you can move on to the next slide. And this is from last week, so the data is not quite updated. We update it midweek every week, but the overall ratios still hold the same. Why did Tina mention that vaccination is the best way to prevent hospitalization and serious illness? Because not only does international national data support that, but our data supports it. So this is as of mid last week, when we had 272 hospitalized inpatients. 85% of those folks, of the inpatients, were unvaccinated. Of our ICU patients, 94% were unvaccinated, and of those patients on a ventilator, 95% unvaccinated. And those ratios have been holding true for weeks and weeks now. And interestingly enough, for those people that are unvaccinated, they are markedly younger, on average between 11 and 20 years younger than those that are vaccinated, and they have many less comorbidities, meaning they are healthier. So what does this tell us? If you are younger and healthier and you're unvaccinated, you have a significant risk of being hospitalized, being in our ICU, being on a ventilator, or even dying with COVID-19. And if you're vaccinated, there's no vaccine that's perfect, you are very well protected, and it's only a small number of older and sicker people that end up in our hospitals. This is why there's such an emphasis on vaccination. The other thing I want to add to this is that today we have 18 children admitted to Helen DeVos Children's Hospital who have COVID-19 positivity. That is higher than any time we've seen. We've been in this 15 to 18 range now for about 5 days. Typically during this pandemic, we would be between the 1 to 5 range. So that is significantly higher, including 6 kids who are critically ill in one of our ICUs in Helen DeVos Children's Hospital. So definitely something we are watching very closely. With that said, I will turn it back to you, Carrie, for the Q&A portion.
Thank you, Tina, and thank you, Dr. El-Mucci. Now we will turn to your questions, so please place them in the chat, and I will call on you in the order that they appear. I should also point out that we have Brian Brasser joining us this morning. Brian is our Chief Operating Officer of the Grand Rapids Hospital, so he will also be here to answer questions. So why don't we start with Nick Lefebvre. Nick, if you want to go ahead and answer your question from WZZM.
Thank you very much. Question is basically, do you believe that schools are your biggest drivers of new cases, both students themselves as patients and those who bring them home to unvaccinated parents and grandparents and siblings?
Great question. I'll take that one. So the good news is students themselves are very rarely hospitalized. Even when I talk about 18, that's still a relatively small number compared to the number of under 18-year-olds we have in the community. And that's a testament to the fact that even without the vaccine, kids tend to generally do well with COVID. But your second portion of the question, I think, is a very good one, in that there's a lot of evidence across the whole country that kids, predominantly unvaccinated kids, have a high risk of both contracting COVID, even if they have minimal to no symptoms, and most importantly, to spreading COVID to loved ones at home. And so I can't speak specifically to the Michigan data because I have not seen it, but the national data says that youth are a predominant driver of COVID-19 transmission in this surge.
Thank you, Daryl. Let's turn it over to Jacqueline Francis for your question.
I don't know if you're able to hear me.
Yes.
Can you? Okay. Are ventilators in short supply, and how many are available versus the number currently being used?
Take this one. Early on in the pandemic, when it was unclear what to expect, and we were watching the media on the East Coast, we were seeing outbreaks on the east side of the state. Our teams were really aggressive about ensuring that we had all of the ventilators that we had in stock were currently ready to be used, as well as procured additional ventilators. And so at this time we have plenty of ventilators. It is logistical. The teams work logistically to make sure that those are where they need to be, because we are seeing very sick patients at all of our hospitals. And so there may be times when we are moving ventilators from one hospital to another to meet the needs of our community. But we do have plenty of ventilators on hand.
Thank you, Brian. And I see that Kate has a follow-up that we will follow up offline. So we can go to Nick for your next question.
Thank you. And this is a follow-up to my previous question. Given transmission that we're seeing from students to people in the home, if it was your decision to make, and we know it's not, you have to rely on school boards and the state government, would you shut down schools to remote learning again right now?
Well, as you said, it's not our decision to make. And so what we've always said is we need to practice the prevention measures that we know work. And that is washing your hands, wearing a mask, and if you're eligible, to get the vaccine. And we continue to promote that prevention measures.
Thank you, Tina. If you have any other additional questions, please post them in the chat. One question I might ask for the group is this a trend that we're seeing across the state, or is this something that we're just seeing here on the west side of the state, as far as these numbers and the escalation goes?
Yeah, I can take that. I know that Tina, Brian, and myself are in constant contact with leaders at healthcare systems across the state, different hospitals, as well as local public health officials. This is absolutely now occurring across the state. I will tell you that in this most recent slow surge that we saw up until the last week, West Michigan was particularly affected. We had more proportion of COVID patients and higher positivity than most of the East Side towns and hospitals had. However, in the last week, everybody has seen this massive uptick, and everybody, and I mean everybody, is very full with non-COVID care too. So these combinations, coupled with the nationwide staffing issues, and quite honestly, with just tremendous fatigue by all of our team members who've been battling this for really the last year plus of huge volumes and very sick patients, the whole state is suffering right now.
Thank you, Dr. El-Mucci. Let's go to Dustin for your question, please.
Hi, I'm wondering if you can give us an update on the patient caregiver ratios, specifically for nurses, the nurse to patient ratio in COVID units, including in the ICU units. Are those roughly the same as in previous surges? And can you maintain them if the numbers keep going up? What are the plans there?
So Brian, maybe I'll take that one and you can add in if you have something to add. So, we're a very large health system with multiple hospitals, and within hospitals, multiple different units. We don't have an overarching staffing ratio that we're currently sitting at. Rather, we try to have as many staff as we can to care for the right number of patients. And the biggest risk that I think we all run going forward is that more and more patients doesn't mean that we have access to more and more staff across the state. And so what we're trying to get out here is that right now we absolutely are providing, we believe, excellent care, but I think all hospitals within the state of Michigan could be in a situation in weeks and months, if this COVID surge doesn't abate, that we could be in situations where we're using staff in ways that they haven't traditionally been used, and where that it will be challenging to provide all the level of care that we're all providing. And so one of the things I will say right now is that most hospitals within the state of Michigan are limiting transfers, meaning they can't accept patients they normally would accept because everyone's so limited with staff and with beds. And that would be a risk that we all run without the proper decrease in COVID that we hope to see. So without giving you a fixed number, I can say right now we feel pretty comfortable. With that said, that could change in the coming weeks.
Daryl, I'd just add to that too. Our teams are working very, very hard. Our clinicians have been working extra shifts, and they've been doing that for a long time. The impact of the pandemic is now being felt in ways not only with the surge and the upward trajectory, but now the duration. And as we get into months 18, 19, and 20, our team members are very tired. They are incredibly resilient, but we do see times where the staffing ratios are not the same. We work very hard to make sure that we are able to move our teams and our team members to where the needs are. And so as we work through that, and as collaboration across all of our hospitals, across all of our disciplines, and it's really remarkable to watch. But as Daryl said, this grows more and more problematic as that number gets higher and higher.
I'd also add that we're just so thankful for the team members and the caregivers, physicians, nurses, advanced practice professionals, respiratory therapists, you name it, everybody in our organization, even environmental services and IT and nutrition. It really takes a village to care for our community, and they've done a fantastic job. But as Brian said, they haven't had a break. We've been in this pandemic for 19, 20 months, and there's stress in providing this level of care, and it's continued with the pandemic. People are very sick, even if they don't have COVID. And we know that everyone has physical issues, but also mental health issues. And so we ask for our community to recognize our healthcare workers and other workers that it's your neighbor, it's your friend, it's your family member behind that mask that's caring for you, and to say thank you and appreciate all the work that they are doing to keep our community healthy and safe.
Thank you, Tina, and thank you, Brian. Before we go to Kate, I think I missed a question from Jacqueline. We'll go to Jacqueline at this time.
Yes. Have there been any pediatric COVID deaths at Helen DeVos Children's Hospital during this most recent wave or surge?
The short answer to that is yes.
Are you able to elaborate or say how many?
I cannot. I believe there was one. I can't elaborate any further.
Thank you, Dr. El-Mucci. Kate, let's go to your question, please.
Yeah, hi guys. Thank you so much for holding this press conference today. This is really helpful. And thank you also for just taking this question. You've spoken a little bit, Dr. Almucci, to the capacity issues that are coming from non-COVID, that the hospital overall is about 85%. I'm wondering if you can talk to where the health system is feeling that, particularly if there is a particular area like labor and delivery, emergency departments. And also if you can just talk to, I think sometimes the capacity numbers don't necessarily show the acuity levels that we've been seeing in some of the other health systems after people had to put off care for a long period of time. And I imagine that can add strain as well. So if you could speak to that, that would be great.
Yeah, no, I really appreciate the question. And so first of all, maybe I'll start with the second part, the acuity. You probably all heard this before, and we have some theories. We just don't know exactly why, but across the state and definitely in our region, we have seen our acuity elevate and stay persistently elevated essentially since late last summer, early last fall. I'm talking about 2020. We've had 12 months, and we measure this. This is something that we report to the government, even something called a case mix index, which shows the acuity of inpatients has been higher than it's ever been persistently at Spectrum Health ever since the formation of Spectrum Health in 1997. So there's been high acuity. A lot of that potentially is from deferred care, but that probably doesn't explain all of it. As far as certain areas where that is focused, there's not really one spot we can say we're seeing more than others. It's really relatively evenly distributed. I will say and give a shout out actually to those that work in our emergency departments. Our emergency departments have seen volumes like nothing we've ever seen. We've had days where we've been, 10, 20% higher than our prior records in terms of emergency room volumes. And these are sick people. We've expanded dramatically our outpatient access, virtual care, and so many things to be able to provide care to people in their homes or provide care to people outside of the ER. So only the sickest of people that need to come to the ER come, yet still they come because they're very sick. So this is really across the board. And these capacity issues are really a challenge, I think, not only for the whole country, but definitely for the state of Michigan and definitely for us.
Thank you, Dr. Almucci. Nick, you have another question.
Yes, thank you. You're giving this press conference right now, but there's a limit to how many news organizations are going to pay attention to one of your press conferences. The governor has a much larger platform, but she hasn't held a COVID status press conference in months. Would that kind of exposure help you get out the kinds of messages you're trying to deliver right now if she were to start talking to the state as a whole during these press conferences again?
Well, I think all of us throughout the state and healthcare organizations are talking about this issue and trying to raise it up in our communities. It really is action done in our local communities that will have the greatest impact on the case volumes that we're seeing here. We do need people to be vaccinated. We do need people to take those prevention measures and then to really think about their health. We want to make sure that we are here for our community, whether it's COVID-19 or some other health condition, and we want people to be able to come to us to do that. And so it's really important that we get out what's going on locally so that our neighbors, our friends, and our families and every community understands what they can do to contribute to the health of our community.
Thank you, Tina. And just a reminder, if folks could mute their line, that would be helpful. Thank you very much. I don't see any other questions in there, but one thing maybe the team could comment on is the vaccination rate for Spectrum Health team members. If you want to give an update on that and how that process is going.
Brian, you want to take that?
Yes, I'd be happy to. Yeah, so throughout this fall, we have been working through the vaccine requirement with our team members. We have a very interactive process to allow them to get scheduled, easy to get vaccinated, and many of them have. We've also instituted the exemption process for both deeply held religious beliefs as well as for medical exemptions. And between those that are in compliant, very proud to say that 99.75% of our team members are compliant. And so as we talk about the staffing challenges that are facing us, it is because of the responding to the needs of the community. It's, as Daryl said, it is not just the numbers of people seeking care. They're very sick. And so the acuity drives even more utilization of our team members. So I think it's really important because we see a lot of information that seems to lead people to think that it's because of a vaccine requirement, and that is absolutely not the case at Spectrum Health.
Thank you, Brian. Dustin, let's go to your question.
Yeah, just wondering, in previous surges, you've canceled some inpatient procedures. Is there any thought of doing that again? One, has that happened in this surge? And is there any thought of doing that again, given, what you're seeing in terms of other illnesses? Is that even something you'd consider this time?
Yeah, the reality is that we have deferred far more procedures than we would like. We've been deferring surgeries in our Grand Rapids hospitals, primarily on the adult side, but from time to time in the pediatric world as well. The pediatric, the Helen DeVos Children's Hospital is world class. They are seeing an increase in patients in the children's hospital as well. They've been able to maintain most of their surgery schedule, but on the adult side, for the past 14 to 15 weeks, we have had to make the very, very difficult decision, partnering with the surgeons themselves, working closely with them, their offices, communicating with the patients. But it has been the better part of the last 14 or 15 weeks. This week is particularly bad because we not only have to defer surgeries that require an overnight stay, we have to defer surgeries so that we can free up space in our recovery room to take care of our inpatients. So as we think through this, there's surgeries that have been deferred. We are postponing some. They're all low risk. They're again at the discretion of the surgical team. But each time we do that is problematic. It's problematic to the patients and their families. And as Daryl alluded to, we really believe that a lot of the non-COVID activity that we're seeing, the severity of illness is such because of deferred care earlier. And so we recognize that is a form of deferred care now. And so we take that very, very seriously, but it is absolutely impacting operations in that way.
Thank you, Brian. Mark Sanchez, let's go to you for your question. Mark, I don't know if you're on or not. If you want to ask your question.
There we go. Can you hear me now?
We can.
Okay. I was curious. I was looking at the third quarter financial reports posted last week online, and I was curious, all of this, the deferrals, the wage pressures, the staffing issues, how's that affecting the health system's financial picture? And there's a line in there that stood out about fourth quarter negative impacts. It's curious how the finance is holding up and what do you expect for the fourth quarter? And I have a follow-up question as well.
Mark, thanks for the question. So we're paying attention to our financials. As you know, healthcare is, we operate with a slim margin, and we want to make sure that we can reinvest that in our organization and our communities for improving health. And as Spectrum Health, with an integrated system, we have a balance of care delivery as well as insurance with Priority Health. And so where you see on the financials, there is revenue associated and expense with caring. There's also revenue and expense associated with the insurance. As we're seeing more people utilize health services, that means the Priority Health is paying out more for those services. And as you see the deferred care, we're not generating some of that revenue that was initially planned. We've also done some changes in the month of October and November to increase certain pay ranges and be more consistent with the market. And so those will be evident in the fourth quarter financials as they come forward. Overall, we're managing that appropriately consistent with our budget, trying to make decisions that, again, will help us navigate the COVID-19 pandemic and all the other things that are with us, trying to make sure a culture that is focused on our values and allows us to deliver on our mission to improve health, inspire hope, and save lives.
And just to follow up, some of the surgical deferrals you're doing right now, can you gauge how many of the patients coming in for surgery are resulting from that traditional fourth quarter increase in capacity? Folks have met their deductible, so they're getting those elective procedures done now. Is there any way to gauge that, and as far as how much that's contributing to what you're seeing right now?
Mark, I would say at a high level, it's a good question. It's at a high level, we're running at the normal volumes that we would see across the course of the year. We're actually starting to see a little bit of our surgery schedule ebb because our surgeons are recognizing the situation that we're in, and so they aren't even scheduling the patient because they know that we are running at such high capacities. We do know as we have conversations with patients that this does weigh on them. We do know that that does play a role. And so we're working very closely with them to help in any way that we can.
Okay. Thank you.
Thank you, Brian. I know we're about at time. Oh, I think, Nick, you've got one more question. Why don't you go ahead and then we'll do some closing remarks.
Thank you. And just very briefly, I know this was talked about early on in the pandemic. Considering the numbers, are you preparing or planning for any COVID field hospitals or locations at all?
Thanks, Nick. I can take this one as well. So as we look at our surge capacity, we think of it in terms of that alternate care site, which is kind of the formal terminology for a field hospital, but it's not just for field hospitals. And so what we've identified is we've taken a very close look at the needs that we project, at our staffing, that it is better for us to surge inside our hospital. So for example, as many of the field hospitals that you've seen them with canvas dividers, 10 by 10 rooms. That's basically what's considered ward style care in many situations. That is suboptimal, and I think we can all recognize that. We identified that we have conference space, we have shared workspaces that could be converted, that would provide the proximity to the services that our patients would need. The challenge of a field hospital is so often it's standalone. And so having the proximity to our nutrition services team, to our environmental services team, to radiology, to lab, to our emergency response system is really, really key. Having a setting where we're on emergency power at all times, like the hospital is really contributing to that. And so I referenced that we are caring for some of our inpatients in our surgical recovery space. Our teams have worked very hard to identify those spaces that would be appropriate for care, but it would reflect a contingency capacity so that we can flex up. We've added about 75 beds. We are using all of our beds. We've added through emergency certificate of need requests and licensure. We've added a capacity of over 50 ICU beds. That means that we've had to upskill our staff to do that. We've had to procure additional equipment and supplies, but we are building out plans continually to take that next step and 2 and 3 and 4 steps down the road.
Thank you, Brian. We are about at time, so I'm going to turn it over to Dr. Almucci for some remarks, and then we'll go to Tina for closing. Thank you.
Thanks so much, Carrie. So, we've all been at this for 20 months, and the word unprecedented has come up so often over these last 20 months. And I will say, because it feels a little bit like the boy who cried wolf, what we're experiencing today is unprecedented. We have not experienced anything like this throughout the entire pandemic. The combination of non-COVID acuity and volumes coupled with dramatically increasing COVID care. And so we want to, first of all, emphasize that to everyone. I want to paint the picture that, first of all the things that Tina had mentioned, that we'd all mentioned that folks can do to help prevent themselves from needing hospitalization, like getting vaccinated and like using common sense prevention, they really work. And trust me, you don't want to come to a hospital unless you need to come to a hospital right now. And then I also would say that those that do need the hospitals should come, but expect longer wait times in the ER, both at Spectrum facilities and across the state, without a doubt. For those that end up in a hospital and need transferred to another hospital for a higher level of care, that's going to be a challenge across the board. We typically get 50 plus transfer calls a day to come into our system, and we always try to take everyone we can to offer them higher levels of care, particularly in our tertiary and quaternary hospitals in Grand Rapids. And because of these capacity constraints, we're down to taking under 10 typically a day, and we do our best to try to prioritize and bring those folks in, but that's a challenge across the state without a doubt. So please know that we're all doing the best we can, but we really, really need people to understand where we are now and what we anticipate over the coming weeks if things don't improve.
Thank you, Dr. Almucci. Tina, why don't we turn it over to you for closing remarks?
Thank you very much for joining us and for helping us spread the message about what's going on here in Michigan and in West Michigan. We really want to see if our communities can help us drive down the positivity rates, the hospitalizations, and the illnesses. And so there's a couple things. One is that if you need care, seek it. You don't need to wait. We are a safe environment. We are here to help you, and we want to make sure that we can help you all the time. You're welcome to go for a virtual visit, your primary care physician, urgent care, or emergency room if you're having an emergency. We also strongly encourage you to get vaccinated. And if you've been vaccinated, you're also encouraged to get your booster as soon as you're eligible. And then also mask up. We know that that will protect from COVID-19. It will also protect from the flu, which we know is in Michigan. And then lastly, I just want to say thank you to all of our caregivers and our team members. And please share a thank you with them if you know them as well. They're doing an amazing job in caring for our community, and we are grateful that we have them here with us during this 19 or 20 months to really care for our physical and our mental health needs. And that's what's helped our community stay healthy and for us to continue to focus on our mission to improve health, inspire hope, and save lives. Thank you again for joining us, and have a good day.
Thanks, Tina, Dr. Almucci, and Brian. For the media, thanks for joining us. If you have any follow-up questions, please reach out to one of our media relations staff. Have a great afternoon or morning, everybody. Thank you.